my name is Lisa O'Brien and I am a speech and language therapist here in the Cancer Centre working for the Belfast Trust. So today is the 4th of February, which is World Cancer Day, so I just want to talk briefly about this and the role of speech and language therapists, or SLTs, play within the cancer care. So there are many causes of cancer, but we know some risk factors do include alcohol excess and smoking. There is also a certain group of head and neck cancers caused by the HPV virus. SLTs are part of a large multidisciplinary team that work with children and adults who have received a cancer diagnosis. The role of the SLT is to treat people who experience communication and or swallowing problems as a result of the tumour site or affect their cancer treatment, such as surgery, radiotherapy and chemotherapy. So we see a wide variety of cancer types which can impact on the communication and swallowing. For example, head and neck, lung, brain, hematology conditions. Head and neck cancer is the main diagnosis that I work with. It can result in slurred speech, a hoarse voice, and also difficulties with eating, chewing, drinking and swallowing. So sometimes if there is a weakness in the swallow, this can put a person at risk of choking or aspiration. Aspiration is when food or drink reaches the lungs instead of the stomach, and this can cause chest infections. So this weakness can also affect the person's ability to eat and drink adequately to maintain their weight, which we know is very important. I also work with people who have been diagnosed with brain tumours, so this can impact on their communication, so both understanding what's been said and expressing themselves. Sometimes it's the tumour itself that causes the problems, but sometimes it's the side effect of the necessary treatment. So we are keen to provide input from diagnosis until after treatment. An example of this is seeing patients with a head and neck cancer diagnosis before they begin radiotherapy treatment for the purpose of prehabilitation. The goal of prehabilitation is to prepare the person for treatment, where we would give exercises to help strengthen the muscles that are likely to be impacted, provide education on the side effects and strategies that could be used to experience swallowing and or communication difficulties. Living with and beyond the cancer diagnosis is a key part of our role here in the Cancer Centre. So we try and enhance quality of life by providing rehab with the aim of helping the person to achieve their maximum potential to live well after their cancer treatment. At times, this might mean giving advice on adapting their lifestyle, so choosing more manageable food textures for a menu or using a device to help communication, like a boogie board. If you want to find out more information, you can visit the Macmillan website. That's at www.macmillan.org.uk.